time is incredibly crucial. Every minute that goes by, people lose about 2 million brain cells.
When someone is having a stroke, getting clot-busting TPA drugs to them can turn things around, but the medication has to be given within hours. Enter the Cleveland Clinic's Mobile Stroke Unit. Complete with a mobile CT scanner, a blood lab, and immediate access to doctors via a smartphone app, the so-called Strokemobile is dispatched around Cuyahoga County whenever a stroke is suspected.
This is the CT scanner that is used to evaluate the patients. The images are generated on this computer. The entire ambulance is a giant Wi-Fi hotspot and wired for Ethernet. So the images are immediately sent up through a antenna on the roof of the ambulance back to the Cleveland Clinic to be reviewed by the stroke neurologist and the neuroradiologist. Patient is brought in, they're laid on this gurney. Cleveland EMS has already drawn the patient's blood. While we're waiting for that, the patient is placed inside the CT scanner and the CT scan of the brain is completed.
How long does that CT scan take?
It takes about 35 seconds.
So you could have someone come right in here and within 2.5 minutes have your diagnosis, CT scan looked at it by a stroke neurologist, and all set.
That's absolutely correct.
Stroke symptoms often include vision issues, severe headache, paralysis, which is often on one side, trouble walking, and confusion.
I was admitted on Sunday, discharged on Tuesday with absolutely no residual from the stroke whatsoever.
Kathy Brooks was visiting Cleveland from Shreveport, Louisiana.
We had come to the Cleveland Clinic for my granddaughter who was here for heart cath and potentially for heart surgery.
Out for a day of sightseeing between her granddaughter's appointments, family members noticed something wasn't right.
She gets out of the car and I noticed that her left side she wasn't really using her left hand or left arm, and she wasn't using her left leg. She was dragging it.
I was in the midst of a really true acute stroke episode. I saw black and white cars were driving on the grass and they weren't even really there.
If you look at the goals for time of treatment when someone arrives to an emergency room and they're having a stroke before they get TPA, the goal is about 60 minutes. We're averaging half of that, about 28 minutes on this unit. And the fastest time someone has gotten TPA when they've been brought on the back of this truck has been 11 minutes, which is just absolutely unheard of in this kind of treatment realm. It's a completely new paradigm for the management of patients with stroke.
I feel great. I can't even believe I really even had a stroke. It's just that whole experience. Thank goodness for, for these people and the van. It was awesome.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.